This is The Bottom Line. The Bottom Line on 938 Live.
The global mobile healthcare market is projected to grow by a compounded annual rate of above 25% to reach over $20 billion by 2018. And while there are plenty of apps and devices that will monitor a user's health through smartphones, Singapore's BioSenze says it's time to take it to the next level, into mobile diagnostics. It says its flagship biometrics device, unveiled at CommunicAsia, will be able to detect between 20 and 50 different ailments, including dengue fever and hand, foot and mouth disease by the end of the year. The disposable device does this by testing a blood or saliva sample while connected to a smartphone. To find out more, Travis Teo spoke to BioSenze's managing director, Michael Tan.
I think the aging population or silver tsunamis is very real. So with aging population, healthcare costs goes up, and then there will be overconsumption of healthcare resources, and then leading to wastage, and of course a lot of burden on the healthcare system. So based on statistics, there is one senior citizen for every 13.5 what we call adults aged from 20 to 64. That was like in 1970. So in 2000, it's actually been reduced dramatically down to 8.4, and then by 2020, it's going to be only 3.6. So this thing is a very real problem, and percentage of senior citizens over the entire population has also climbed, steadily.
Progressively, what are the trends in mobile healthcare?
As of right now, a lot of people are using health monitoring. So I think that's the thing which a lot of people are preaching right now. So, the big boys, Samsung, Nike, Apple, so those things that, allow people to monitor the way they exercise and the sleep patterns, the pulse rate, all these things. I think monitoring is the big thing right now. But over time, I think things like diagnostic, I think is picking up as well.
Right,
Yeah.
and for your company BioSenze, I understand it has a diagnostic product. What is this product about, and which area of the market are you hoping to target?
Our BioSense product is something like a diagnostic lab in your home. So you'll be more targeted to patients with chronic diseases that require a lot of constant monitoring. So an example would be somebody with high cholesterol. So the patient can actually use one of our BioSense device and conduct a weekly test, and those test results will be able to reflect on the patient's mobile app within like 10 minutes, and then the same data will be sent to our cloud server, and then this patient's doctor can be notified and be able to keep tab on the health condition of this particular patient.
But with self-diagnosing, isn't there a risk of getting it wrong?
Well, as with all things, there are certain margin of error. But ours, through our own lab test, is more than 90% accurate. So ours is like a preliminary test. So once there is a certain exception, which is something which is not the norm, then the application will actually advise the patient to go see the doctor immediately.
We take a look at the trends here. Recently, Apple unveiled its health kit and health app. Samsung has Sammy, which is a fitness data tracking platform. So do you
Yes.
see these different companies with their apps and their programs? Do you see it as complementary to companies like yourself?
I think what the big boys like Apple and Samsung has done is they actually created a platform. So it's a platform that is able to aggregate different data. So diagnostic could be one of the data that goes into the Samsung or Apple platform. So their users could be able to see what's happening and have a better overview of their overall health situation.